I'm your host, Dr. William Dodd, from the East Tennessee State University Health Pediatrics Adolescent Medicine Clinic. This podcast is not intended to provide medical advice. If you or a loved one are working through medical problems related to today's topic, please consult a personal physician. I have no conflicts of interest to disclose. Today we have a discussion of preventative care in pediatrics, all the way from infants to adolescents. I'd like to welcome everybody to today's program. I'm your host, Dr. William Dodd with ETSU Health Pediatrics, and today it's my pleasure to welcome our guest, Dr. Sukhvir Singh. Dr. Singh is a fellow pediatrician here at ETSU Health Pediatrics. Prior to joining us as an attending, he was a resident here at ETSU in pediatrics, and previously to that, he went to Des Moines University, where he attended med school. It's a bit of a change in scenery, Dr. Singh.
Yeah, I grew up in California and moving out to Iowa, and then here I live in Piney Flats in Tennessee. And I think smaller I go, the more I like it. So I think we're here to stay for a while.
Well, you can't beat the traffic.
No, you cannot.
So today I wanted to bring Dr. Singh on to have a discussion about kind of a very important topic. It's kind of the bread and butter of a lot of what we do in pediatrics. And I also think it's a thing that a lot of people don't think about from a systemic standpoint. You know, anybody with kids brings them to well visits, and pediatricians talk about a lot of topics at those well visits, uh, but I think it's important to kind of look at in its own right and think about things from the standpoint of preventative care and screening and kind of a lot of the things that we do. It's an interesting topic. It's a broad topic, and today we're just going to kind of talk about a broad overview of this topic, and maybe we can go a little bit more in depth here in the future. So, Dr. Singh, uh, what exactly do we mean when, as a doctor, health professional, we say preventative care?
That's a great question. I feel like a lot of folks sometimes have this misconception that I don't need to see the doctor unless I'm sick, and my kid doesn't need to see the doctor unless they're sick, just because they might bring the child in when they're concerned about things like, upper respiratory infection. Maybe they're
Mhm.
sick at school and they need a note for that. They've got an infant who's been pulling out their ears and they're worried, hey, is this teething? Is this an ear infection? Or, my teenager's been coughing for 3 weeks and now has fevers. And I'm worried about things like a pneumonia because he's complaining of shortness of breath. And we do like to treat, lots of acute illnesses and try to help prevent them from becoming chronic ones if possible. Um, but preventing illness is just as important and arguably sometimes more important uh, uh, than treating illness before it happens.
Yeah, absolutely. I mean, especially in pediatrics, if you catch an illness in a baby, or like depression in a teenager or something, that disease could impact their entire life. And uh, we're assuming that uh, the children have their entire lives ahead of them. And if you can prevent an illness, you not only prevent uh, you know disability from that illness, but you prevent a lot of pain and suffering on the part of the child.
Exactly. I think the goal really with the preventive health is that sometimes mitigating risks and preventing problems before they turn into big problems down the road and as the child grows. Um, um, we can do lots of things for preventative care. Some of them are a little bit more active, but we can do things like screening with verbal questions and sometimes questionnaires that we put out for families that can help us dictate whether or not we need to delve into any specific issues that the children and families might be having, and also making sure we introduce things like vaccines to help protect against preventable diseases in
Mhm.
counseling, so the family understands how the child's needs and care and may change as they get older. And that can vary greatly. The counseling, obviously, that we're going to do for an infant's family versus a teenager's family is going to be very, very different, but it's just as
Sure.
important in either case.
Yeah, absolutely. I mean, it's kind of like the thing that we do at well visits. I mean, if you're looking at prevention kind of as a broad topic, is there any way you can maybe split up prevention or look at prevention as subtopics or the different types of prevention?
Um, yeah, I think one of the two main ways we can split that up is primary prevention, and that can be things like talking about the safety of medications and things like that, uh, and then secondary prevention might be things like uh, detecting cholesterol issues early and then treating early before it becomes a bigger problem down the road.
Okay, so like primary prevention might be something like where you're intervening on an illness that the child does not have to prevent that illness. So, for example, when we have a teenager or an adolescent, and we're talking about HPV vaccination to prevent cervical cancer. They don't have cervical cancer. They don't have cervical dysplasia. They hopefully don't have HPV that would cause that. But by vaccinating them, we prevent them from getting that illness in the future, hopefully, which, is a devastating illness and worth preventing. It's the leading cause of cancer death among young women. And if we can prevent that illness is very important. It's no less important than treating an ear infection, for example. Uh, primary prevention is very important for the patient's health. What what about in terms of secondary prevention, where they have an illness and where they may not have symptoms of that illness? What are some examples of that, Doctor Singh?
Yeah, so secondary prevention would be maybe doing things like screeners that would help us identify a problem that maybe the parents have not seen yet, or maybe they've been a little suspicious of, but have been unable to put their finger on what might be going on. So sometimes we might be asking, 6 month old baby the families for 6-month-old babies, what is your baby able to do motor wise? And if they
Hmm.
say, well, my baby's having a lot of trouble, holding things and um, doesn't really have a whole lot of tone at all to be able to sit up with some support, and that might raise some alarm bells as to maybe things might be going on when it comes to neurological issues or motor issues for the infant. If the
Hmm.
child has a delay, then it would allow us to put in for like a physical therapy referral so that we might be able to mitigate the risks of any long-term consequences of that in the future. And if a child might have something like autism, screening for that when they're 18 months old and 24 months old, that's something that the child would already be showing symptoms of at about that age. And if we are able to identify it, then we're not able to always fix the issues. But for
Hmm.
things like autism, it would allow us to um, make sure the family and the child get support so they can thrive as much as possible with their issues.
Yeah, and that's so important as well. I mean, so much of parenting is trial and error and instinct and somebody who has a 6-month old and is waking up all night and dealing with, I don't know, teething uh and introducing foods and changing diapers and all the other chaos of everything may not pause to think, if my baby's not rolling over, is that abnormal? It's not something that leaps to mind. So having that well child check and getting that screening and intervening if there is a delay, so important. Uh, wh- what about in terms of the primary prevention? That preventative counseling. Uh, you know, what sort of uh, counseling or uh, advice do we give at well child checks that would fall into that category?
Yeah, that's a great question. So the primary prevention and the counseling that we're going to give to families as the children are growing during their well child checks is going to change, based on the age of a child. So, for example, for during a 9 month old well child check or a 12 month old well child check, the most important things I need to talk to the parents about is making sure the house is safe. So making sure we keep firearms and chemicals and medications locked up,
Mhm.
making sure kids can't to get to things that they can choke on, things they can pull down on themselves.
Mhm.
And then for a teenager, it might be something very, very, very different.
Yeah.
Are we making sure that they're exercising? Are we making sure that uh, um, that we're eating healthy, avoiding junk foods,
Mhm.
making sure we're maintaining, parents are in tune with the children's mental health, things like that.
Sure. I mean, I always like to tell parents and teenagers like the habits that they build when they're teenagers and their adults in their life are uh, helping to direct them to form these healthy habits. They're going to carry those the rest of their lives. It's hard to start eating vegetables and exercising if you didn't kind of grow up doing some of that.
Yeah.
Uh, it's just we're creatures of habit. And preventive counseling's one way to kind of change the course of somebody's life. What about screening? What's screening?
So the goal of screening really is try to catch a problem before it turns into a bigger problem or before it really even starts. The main goal is we're trying to detect a potential health issue, and then early enough that we can timely intervene and decreases the chance of an adverse consequence. So really, the goal is to improve the long term health of the child and improve the chances of appropriate quote unquote normal development. Um, and we find that if we do appropriate screening, it can really, really, really help set them up for success
Mhm.
later on by decreasing the chances of kids getting to a point or chronic illness is getting to a point where it's harder to fix.
Yeah, so, you know, I always like to say screening's like a uh, check engine light, which, I know check engine lights are extremely annoying. But, when it comes on, you don't know what's causing it, but you probably should figure it out because, if you don't figure it out, it could lead to a worse problem. It's worth investigating. And sometimes it's nothing. I used to have a minivan. The check engine light would come on all the time is because the gas lid wasn't detecting itself being screwed on enough, and so that would be like a false positive screener, but still worth figuring out. Uh, an example in teenagers, we use a tool called the PHQ to assess teenagers for depression, which isn't always obvious in teenagers. They don't always feel depressed. They can also feel disengaged or feel apathetic uh, about doing things, and so we have a screener called the PHQ that asks a bunch of questions that are all symptoms of depression. The adolescent marks on that form whether they experience those symptoms infrequently or frequently, and you can kind of use that as a tool to screen for depression. But there's a lot of stuff that can mimic depression uh, that you'll have a positive PHQ, but it doesn't mean a child has depression. For example, if a child is using their cell phone when they're trying to go to sleep and they're getting like 3 hours of sleep, they may put on that form. They're tired, they have low energy, they speak slowly, they have trouble concentrating. Uh, they they may even kind of feel a little bit depressed because they're sleepy a lot. but that doesn't mean that they have a clinical depression. So when you have a positive screener, it's important to kind of drill down and figure out why that screener is positive and what that screener means. Are there any examples from early childhood that you might have a screener that you or a screening test that you do that may have different meanings?
Yeah, so I would say maybe infants, one of the earlier things that we can do that uh, that can detect issues later on is maybe checking for head circumferences. Sometimes
Mhm.
parents are wondering, why do we do that for? Making sure their brains can grow. I'm like, yeah, that's one of the main things is making sure their brains are growing
Mhm.
appropriately, because if their brains are growing, that means their skull's going to grow too. We want to make sure that the sutures, the bones in the head, where they kind of align together, those are fusing appropriately and at the right times. Just because sometimes there can be some true pathology in an abnormally low head circumference or a decreasing percentile there, or an increasing percentile can clue us into, hey, maybe we need to look further as to what's going on here. Are these sutures kind of getting glued together a little bit more quickly? Are we having problems with hydrocephalus and we didn't see that earlier?
Mhm.
And do we need to do any imaging to figure out kind of what's going on? I mean, most of the times, those babies just got big heads, and usually you
Yeah.
can tell if the dad's got a big head, it's gonna
Yeah.
it's gonna happen in the kid too. Um, but yeah, that's really helpful. And I really liked your check engine light kind of way of looking at things, because just like a check engine light, screening doesn't help us clue us into, hey, something might be going on and we should probably jump on it, take care of it quickly, because otherwise it can become an expensive problem later, both financially and when it comes to the prices we have to pay with our health.
Sure. Yeah, you don't want to miss an intracranial problem for sure. Though I will say I have to buy special bicycle helmets because my head's so big. So,
I used to have to always buy the small ones because the regular side stuff didn't fit on me.
oh, you're lucky. Well, Dr. Singh, what makes a if you were designing a screening test, what what would make it a good screener? Like, what do you look for in a good screening test?
I think maybe some questions should be easy for the families to understand, easy
Mhm.
for us to ask. The barriers should be pretty low um, as to administering the test, and you want the test to be very, very sensitive. So
Mhm.
you want to detect everybody who might have the problem. It doesn't mean that uh, the problem absolutely 100% exists in that patient or for that family, but you want to make sure that you always detect it just in case it is happening. And of course,
Mhm.
that's going to lead to overdetection. That's going to lead to some false positives. But as long as we're asking the appropriate questions in order to rule out those false positives, that's a reasonable price to pay, so that we can make sure we get the help to those folks that need it.
Sure. Yeah, uh, it's always a balance though, because I feel like there can be some harm associated with false positives. I've had patients with false positives on HIV screening with kind of borderline cholesterol results that don't really show a good path forward in terms of lifestyle changes. The test itself can cause some worry when there's not really a medical intervention uh, to uh, to fix something. Uh, so I think I feel like that's one of the harder parts of preventative counseling is when you have a false positive, kind of counseling the family and working out a reasonable plan forward. Uh, but what are there any other qualities of screener tests that you would look for?
Yeah, it's so I think it's also important to screen for things that we can actually do something about.
No.
One, because we'd have limited time when we're speaking to families, and we want to make sure that the questions we ask are pertinent to things that we might be able to fix and help them with.
Hmm.
So one example that can be, checking for serum lead levels when a child is 12 months of age,
Hmm.
just because that can really help decrease the chance of neurocognitive issues later on in life if we're able to help families decrease the lead levels in a child where it might have been elevated at that age.
Yeah.
Sometimes we have some false positives there too, and that's okay. Sometimes you got to do some serial checks in order to make sure that the level is coming down. I think in 2021, kind of the level that we're looking for is for the serum level to be below 3.5 micrograms per deciliter.
Yeah.
And if it's not, then we ask the families, hey, let's do some iron supplementation. Let's make sure we eat healthy. Let's make sure that if there's any environmental changes that we can make
Yeah.
by making sure we removed any exposure to lead-based paint, that we do that.
Yeah, absolutely. It's sometimes they'll touch something with their finger and we do a finger stick and they'll sample whatever's on the finger along with the blood and get a false
No
false
fault. Yeah,
positive. I
yeah.
I did that one time when my kid was a toddler. They were vomiting and I got a I did a finger stick blood glucose. I had one at home and like one of those machines that tests and glucometer and it came back like 500 and I just panicked. Uh, Cleaned his hand off really well, rechecked it, it was 70. So, but, uh, but in adolescence, I agree, all the screening that we do, we can act on. Like we screen for depression, we screen for substance abuse. If a child indicates that they're vaping on the substance abuse screener, there are a ton of behavioral interventions that we can do to try and reduce that behavior that could harm them the rest of their lives. Uh, and so much of screening too is related to harm reduction. If somebody has a condition, you want to know about it. So even if they're not willing to stop vaping, maybe there's some things you can work on that'll reduce the risk. Or even if uh, they're in a situation, let's say that you have a college kid who's drinking and they're unwilling to change that behavior, you can always make sure that they're not riding around with people who are intoxicated. Getting in cars, putting themselves in risky situations. That could cause potential harm. So, uh, so yeah, even if you're not fixing the problem, sometimes screening you can use it to work on plans to help the child's health. Uh, how does screening change over the course of a child's life?
Um, so screening is going to change because obviously our needs and health wise and the things that we're exposed to change as we get older. But for infants, the screening might be, they can't do a lot of talking to tell us about what's wrong. So we might have to look for things like biological abnormalities. So,
Hmm.
we do a CCHD where we're going to check the oxygen level, and that indirectly tells oxygen level in one of their hands that indirectly tells us whether or not there's any anatomical pathologies with the heart that we need to look into. We'll do a newborn screen when the kids turn about 24 hours old. That will help us clue into any preventable chronic illnesses that could affect the child. And
Hmm.
a lot of times that's done at the 24-hour mark, just because sometimes the interventions can be life saving, or even prevent long term cognitive deficits, if we start with a an intervention early. Um, and we also want to make sure that the interactions between the family members are appropriate. So that means things like making sure that mother baby interactions are as healthy as they can be.
Sure.
Sometimes postpartum depression is something or about 20% of our moms can sometimes deal with. About 10% of our dads.
Yeah.
It's normal almost with how often it occurs, but we want to make sure that we ask those questions so that we can get those the families that the help that they need if they are dealing with depression.
Yeah, it's kind of a unique situation in screening, I guess, because you're not even screening the patient, you're screening their
Yeah.
mother, but it's so important for the patient.
Yeah, exactly, exactly. And And the screening is going to change as they become, a little bit older babies and some toddlers. We want to make sure that the rest of their development is appropriate. Earlier, I talked about at 6 months of age that making sure that the kids are sitting up with maybe like some minimal support. Maybe if they're 12 months of age, we're gonna ask if, are they pulling up to stand? Are they saying mama or dada or one other word? For toddlers, if they're 3 or 4 years old, we want to make sure that their speech is progressing appropriately. When they're two, that they're sticking two-word sentences together. When they're about 4 to 5, I'm going to make sure that we understand
Mhm.
100% of what they say, um, and that'll indirectly tell us that they are growing appropriately, that they are developing appropriately,
Mhm.
and it'll help us understand and talk to families about, hey, these might be the interventions that we can do early that will help catch the development up to um, um, kind of where it should be if a child should be falling behind, and if sometimes the interventions that we talk to families about aren't working as to things that they can try at home, then that can help us understand, hey, we probably got to put in for physical therapy or speech therapy or occupational therapy or anything else that the child might need at that point.
Yeah, absolutely. The screening is just kinda screening evolves with the growth of the child, uh, and even for adolescents, adolescents sometimes have adult type health conditions, like more and more kids are getting diabetes, so, it's important to screen for sugars if a child's at risk for that, or, depression or substance abuse. You wouldn't screen a toddler, hopefully, for substance abuse, but but it's so important for teenagers. So
Yeah, exactly. And I forgot to mention earlier, and we're just talking more about babies and toddlers, just because I love
mhm.
taking care of babies and toddlers. But when kids get a little bit older, we also want to make sure that they're doing well in regards to their behaviors at school, how they get along with each other, how they're
Oh, sure.
getting along with their teachers. Sometimes parents can say, "Oh, he's just a kid being a kid," but sometimes we can detect behavioral patterns at that point where we can say, hey, mom and dad, kids are trying to understand how to interact with the world. And some of these behavioral issues might be things that, we can help fix when they're young so that their interactions with their peers and their teachers are a little bit more positive in the future. And their interactions with you will also be better in the future. And,
Hmm.
and we want to normalize, hey, we're not trying to change their personality. Kids are going to be kids, we
Sure.
just want to make sure that they're in a healthy place when it comes to being able to interact with other peers appropriately. And of
Yeah.
course, at that age, we want to make sure that they're growing appropriately in regards to their length percentiles, making sure that their weights are appropriate. Because sometimes if they're not, that can clue us into, hey, are there any unhealthy eating habits that we can, gives us the opportunity to talk about with
Hmm.
the families. And sometimes that can indirectly improve the health of everybody in the family. If you get to talk about, hey, let's decrease the amount of the junk food that we're eating. Maybe let's start with learning one healthy recipe and doing that once a week before we expand on that and do that a couple of times a week. And just even talking to them about the growth of their child, you can end up doing good for the whole family when it comes to things like inspiring families to make changes to their diet and their health.
Yeah. Absolutely. I think every parent wants their kid to grow up healthy and happy and do well in school and socially and uh, reach their potential. So, uh, I mean, we've talked about a lot of screening, a lot of intervention, a lot of counseling. Uh, is there any? I mean, it just sounds like a lot. How do pediatricians keep track of all of this? Is there any guiding guidelines or any schedule that they follow?
Yeah, I'm glad you asked, Dr. Dodd. There's the American Academy of Pediatrics. Bright Futures is what we like to use. That was originally kind of composed in about 1994. Just a group of pediatric healthcare experts. and the representative from families got together and said, "Hey, we should probably make kind of a guidelines as to what are the things that we should follow, and make sure our at least, I guess, for lack of a better word, screened for, when children, as children are growing. It was an attempt to kind of standardize pediatric care and the things that we should be checking as pediatricians who want to do the best that we can for our patients and our families. Um, and what it basically does is there's a whole list of things that it outlines that we should do or consider doing based on risk factors that the child, the family might have, in terms of preventative pediatric health care, that we and all those the things that we can do are guided and are different depending on the well check, the age of the child at the well check,
Yeah.
that we're seeing them.
Yeah, it's really interesting. I had thought that the AAP would have likely had some preventative care schedule that they would recommend prior to 1994, which, I may be old, but that seems relatively recent. Uh, and, uh, modern medicine really is a lot different than medicine's always evolving, but I feel like this sort of thing that defines our practice is so important. Uh, it's amazing to think it's only been around for uh, what 30 years. So, uh, and a lot of that has to do with the treatments we can offer too. If you think back to the first pediatrics practice, it was around the time of the Civil War in New York City.
Well,
What medicines were really available then. They didn't have steroids, they didn't have antibiotics, no real vaccinations to speak of. And, kind of as these treatments became available, the things that we can do to help patients kind of increased. And, we have so many ways to prevent harm. The Bright Futures guidelines are very important to practice. And, uh, when well checks, which are an integral piece uh, of preventative care, an integral tool for preventative care in pediatrics. There are a lot of well checks. Bright Futures recommends that we see first time parents or any high risk patient in a prenatal visit. So we would counsel the parent. We would see them at newborn, a couple days into life, 1 month, 2 month, 4 month, 6 month, 9 month, 12 month, 15 month, 18 month, 24 month, 30 month, and then yearly after that. But it's a ton of visits early on in life just to make sure we get their growth monitored, their development monitored, uh, and prevent illnesses that we can prevent with vaccines. Uh, Looking at the Bright Future schedule is very detailed. We can kind of go into detail on some of these topics at a different time. But Dr. Singh, would you mind running through some of the domains that the American Academy of Pediatrics has identified that are important to discuss at these well visits?
Yeah, sure. So there's a couple of things that we try to do during every visit, and there's some that we do, only during some like kind of key visits, depending on what's recommended by the AP Bright Futures kind of guidelines, and you know, based on risk factors and things that we might see whenever we're taking care of patients and uh, uh, talking to their families. So we always want to make sure we get a very good, thorough history at pretty much all the visits of kind of concerns that the parents might have about the development of the child.
Hmm.
When the kids are a little bit older, if they're teenagers, we always, we want to ask them, hey, what do you feel is going on? Because sometimes the parents might not be clued into things that are really bothering the children.
Absolutely.
Um, we want to make sure we're doing things like appropriate measurements. We always want to make sure that the weight is normal and the kids are growing appropriately.
Hmm.
When the kids are young, we want to make sure that their heads are growing appropriately because, like I said earlier, it tells us indirectly whether or not everything's okay inside the noggin. And but we're not going to do that the whole time. We'll do that until they're about 2 years old, and after that, if things are normal when it comes to head circumference, then we don't have to continue checking that. Height is something that we'll be checking the whole time, and if a child might be growing way too fast when they're young, that might tell us, "Hey, is there a hormone issue going on?"
Sure.
Or if they start, you know, their height percentile starts dropping off, then we have to start asking ourselves, "Are our growth plates closing a little bit, kind of too quickly?" And
Mhm.
once kids get a couple years, that's when that's when we start checking for things like blood pressure. Of course, we're not going to do that for an infant, but for older children, it can help clue us into, are there any issues when it comes to hypertension that runs in the family that can affect children? Are there any renal issues that might be causing blood pressure issues for children? Um, Kids are a little bit older, and then we want to check for hearing and vision. So we'll do a screen to make sure that they're hearing the appropriate frequencies. Because if they do have a hearing deficit, then that might impair how well they're doing in school.
Yeah.
And sometimes the teachers might tell the parents, "Hey, the kid's got ADHD, and we need to get the kid medicated." And it turns out actually the kid just can't see the board,
Yeah.
and we've
You
got
see
the
that
kid
so
sitting in the
much.
front. Yeah, and you still can't see it, and once we get classes on him, little Timmy starts, doing great at school.
Yeah.
Um, and we always wanna make sure that developmentally they're reaching their milestones the way they should,
Mhm.
that they're interacting with other children the way they should, with their parents the way they should,
Mhm.
so that just in case there are any deficits or signs of things like autism, that we can make sure that we give them the support that they need early on. Um, when they're teenagers, it's a little bit less when it comes. They are trying to be they are trying to be social, and sometimes trying to be social in the way they feel is appropriate can lead to mental health issues. And we have to talk about, hey, it's appropriate to be social, but we don't want to be um, we don't want to be doing things like smoking and drug use and
Sure.
alcohol use, because that can lead to issues with your mental health. And um, 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 what else what do I want to talk about? Let's see. Well, we're going to do a physical exam during every visit, just to
As
make
is
sure that we
tradition.
don't have. Yep. Making sure there's no gross abnormalities, making sure we don't have any murmurs that are popping up out of nowhere, making sure our lungs sound great, that our limbs are working appropriately. Because
Mhm.
sometimes there are issues that can pop up later on in life, and the kids can appear, completely normal. And sometimes during physical exam, we can discover things like a heart murmur that we
Yeah.
didn't discover earlier, and it might tell us, hey, we've got to get you seen by cardiology, because it's really important to keep your heart healthy.
Yeah.
Um, let's see, and there are labs that we need to do, and other types of I guess that qualifies as a procedure. So we'd want to check things like lead levels when the kids are about 12 months old. When
Mhm.
they're 9, 10, 11 years old, we want to look for signs of dyslipidemia,
Sure.
because sometimes uh, very high levels of cholesterol can run in the family, and identifying that early and getting a child started on medications early if needed, or hopefully making dietary changes as appropriate, can kind of mitigate the chances of dyslipidemia causing issues for the child's heart and blood vessels in the future. and
Mhm.
and we want to make sure we do the screening for sexually transmitted infections for children that are sexually active, or teenagers when they're sexually active. And some of those can be things like, gonorrhea and chlamydia screenings every
Yeah.
year, maybe doing HIV screenings at least once, and that kind of stuff. And that also, doing the screening also helps us kind of open up uh, uh, counseling, so we can talk to them about, hey, we got to make sure that we practice safe sex, and that you're using condoms during sexual activity, in order to decrease the chances of, of uh, transmitting or getting an STI.
Yeah,
Um,
absolutely, and screening, kinda underscores the risk that is associated with certain things, like, even, like, cholesterol screening in the setting of a child who's struggling with healthy eating or weight kind of underscores the importance of working on that, for longer term health.
Yeah, yeah, absolutely. Um, let's see. When they're when the kids are a little bit younger, we always want to make sure, hey, it's really, really important to set up the habit of brushing your teeth
Yeah.
every day, making sure we're using fluoridated toothpaste, maybe doing fluoride varnishes whenever kids are young, making sure that they get set up with a dentist in our area. I'm sure many people are having this problem. We have a, a, a kind of a need for dentists who are willing to see patients with 10 care, just because we have so many families that know that they need to see a dentist, but
Yeah.
aren't able to find one. So this also gives us opportunity to give them lists of folks that are able to take, their insurance, so they can actually get seen. And of course, we're going to give the appropriate anticipatory guidance during every visit about things that the family should be looking for when it comes to the children growing, to make sure that the development is normal, and advice on things that they can do to help the child thrive and do even better they're doing when they see it.
Yeah, absolutely. The anticipatory guidance has no side effects. So, but Dr. Singh, I think we're running out of time here, but it's been a really interesting conversation. I really appreciate you coming on the show, and maybe we can have some more conversations a little bit more in depth about a few of these topics.
No, absolutely. Thanks for having me on. This was a lot of fun.